Other things that we can do, if the heart isn't pumping effectively and there's congestion in the lungs because of that, inotropic therapy, dobutamine, for example, can be useful. And then if we've got infiltration because of pneumonias, then of course we want to get the antibiotics on board so that those infiltrates can be addressed. Promote improved breathing patterns and a patent airway. Get the head of the bed up to help maximize thoracic expansion. Pursed lip breathing to help promote CO2 excretion. Mobilizing secretions, hydration, humidification, and mucolytics. We talked about those a little bit. Chest physiotherapy. Effective coughing and positioning. You know, if the patient's got disease in one lung, there is the concept of lateral or side-lying positions where we put the good lung down. Think about that. Good lung goes down. When we put the good lung down, then pulmonary blood flow and ventilation occur best when the good lung is in the dependent position. Because if you put the bad lung, and when I say bad, I think of a lung that's got a lot of consolidation and a lot of pneumonia in it. Air's not moving in there anyway, so why send all your blood supply there? If you put the good lung down, then the gravity of having the good lung down, where the air is going, normally air rises, but you can't get air into the lungs that are full of stuff. So in this case, the air only goes where it can, but the perfusion goes down. So good lung down. And then the other thing about good lung down is, by nature of good lung down, you've got bad lung up, right? Also, correct? And so that allows for drainage of the affected lung. Percussion drainage allows for secretions and stuff to be mobilized out of the airways so they can be coughed or suctioned out. Promote improved breathing pattern and patent airway. We're still working on that. We want to relieve bronchospasms. That can be done with bronchodilators, and I would imagine that Jeff has hit you pretty heavily with those. You should know them all. Albuterol is your Proventil or your Ventolin. That's a short-acting beta-2 agonist. It stimulates the pulmonary alveolar system and allows for dilation. Metoprolol is Alupent. Aminophylline is a xanthine derivative. It's pretty potent. Theophylline and aminophylline are very similar. Aminophylline is just it's less potent and shorter acting than theophylline, so it tends to be we use more theophylline. Let's see what else. Xopenex is levoalbuterol. That's a newer beta-2 agonist. It has less side effects. What are the side effects of your beta stimulants? Well, they can cause tachycardias, especially if they cross over and stimulate beta-1s also. Nervousness, because you're stimulating the sympathetic nervous system. Reduce anxiety, pain, and agitation. It costs energy to be anxious, to be in pain, but you have to use benzodiazepines and narcotics carefully because they can cause respiratory depression. And the last thing you want in your person who's got respiratory difficulties is for them to stop breathing before you're ready for them to stop breathing. And I say that kind of tongue-in-cheek because really we prefer our patients never stop breathing. Maintain protein and energy stores. We've talked a bit already about the high cost of respiratory problems in energy consumption. They may need enteral or parenteral nutrition. And certainly if they're on a ventilator, they're not eating. So something else has to happen. Enteral will always be preferred and should always be preferred to parenteral nutrition for a variety of reasons. Parenteral nutrition requires a PICC line or a central venous catheter. Parenteral nutrition is a high glucose concentration, typically 70% dextrose. The bugs love it, so that's a problem. When you don't use the gut, The gut then doesn't have a reason to be actively involved in peristalsis, so you get gut stasis issues like gallstone issues, or you even can get something called what's it called? Translocation. I think it's called translocation. The gist of it is that bacteria that just sits in the gut, because the gut isn't moving, because there's nothing in it, can then readily translocate into the bloodstream and can produce infection in that manner. All right. Pulmicare is a particular supplement that's kind of specific to respiratory problems. It just has a little bit fewer carbs in it. Remember that the byproduct of carbohydrate metabolism is CO2. And if a patient's got CO2 elimination problems, then this is the formula for them.